Hello, doctor.
Hello, can you hear me now?
Yes, we can hear you.
Okay, Aini, can you share the slide? Because if I share, then my video and audio goes missing. Just hold on, let us share the slide. Sorry, so sorry for the technical issues.
Okay. I think we can start. Doctor,
Okay,
you will.
Aini, can you put a full slide mode? Okay, hi, very good morning, everyone. Sorry for keeping you guys delayed. So, my name is Dr. Sugun from Bagan Specialist Center. So, health and wellness and lifestyle is my passion, along with emergency medicine. And all I do in ER, the thrill of adrenaline and unexpectedness of ER balance my life by what I do in wellness, trying to make sure people don't see me in emergency department against what I see in emergency department. So trying to make sure metabolic disease get as much as awareness as possible through evidence-based paper and how to combat them versus seeing cases which are almost possible through evidence-based paper and how to combat these two extreme and twice the happiness. Right? So let's get started. Next slide, Annie. Okay. So now in general, previous slide, please. Annie, can you go? Okay, all right. Now in general, I'll be covering on what is health screen, why is it important, what is preventive health screening, what are the package that we have, preparation for health screening, a little bit on inflammation, diabetic mellitus, heart disease, and also liver disease. What we need to have for great health. People are getting sicker and sicker almost every day. What do we do for that? There is more disease than we had 10 years ago. People are stuck with chronic illness, lifestyle disease, which means the disease caused by the lifestyle. So basically, what is health screening? So health screening is aimed to detect disease early in people who look or feel well, and it is different from diagnosis tests which are done when someone is already showing sign or symptom of disease. So basically, health means is feeling good about yourself. We find the disease on the rise when we look at the statistics. We see more cardiovascular disease, diabetic, cancer, autoimmune issues are on the rise all the time. Next slide. So this is a wellness wheel. It's a tool for self-exploration that can help you survey choices and situations that impact your overall wellness. Disease is caused in absence of health, and when we don't have health, we have disease. So invest in prevention, and we need to take care and accountability for our health. So this wellness wheel, basically like occupational, when you see the occupational side, so it is a personal satisfaction and enrichment derived from one's work. Like for spiritual, it means like expanding our sense of purpose and meaning of life. And intellectual is for the recognizing and creating ability to finding way to expand knowledge and skill. So moving on to physical is like a recognizing need for physical activity, diet, sleep, nutrition, and so on. Okay, so next slide. Why is health screening important for everyone? Health screening is a great way to gain awareness and understanding of your own health if you feel perfectly well without any symptom and sign of disease and ensure that you are living a healthy lifestyle. In this fast-paced life, where we are always on the go, we tend to ignore the things that are unseen, even when they are the most important. So, health screening basically help you to find out if you have any underlying disease or condition, or if you're at high risk of any disease. So, it is very important to get yourself screened, even if you feel well. Okay, next. Okay, most of the time we pay the least attention to our health condition until we have run out of time. We fall sick only to discover that we have been exhausted and ignorant about our health issues. We might already know that we were brewing since a long time. So sometimes we are unaware that things aren't functioning properly, depending on how we were brought up or how our interpretation of what healthy means. So we may live with symptoms that we don't realize are direct result of our poor organ function. So what measures are you taking to maintain your well-being? Okay. So this is precisely the reason why many people are encouraged to get a health checkup regularly to stay fit and healthy. Next slide. So moving on to preventive health check, your health and well-being underpins everything that you do, and it is all too easy to take for granted. With early detection and proper medical guidance, and disease and health risk can treated with result in better outcomes. So it will lower your risk of serious complication. Okay, next. What are the reasons you need to do this health screening? As you guys know, even our car gets serviced every 6 months. So the same thing for our health. Regular health examination and tests widely aid in defining your health condition and even finding out problems that already exist and about to face in the near future. By getting checked regularly, you basically improve your chances of living a long, healthy life. Next. And also, basically, most of us are having a sedentary job nowadays. It has become difficult for many of us to slow down and embrace our life. Our busy lifestyle has made us sedentary and given us the repercussion. No matter how much we try, we often fail to follow a healthy lifestyle. It is very important to maintain a healthy lifestyle in today's fast-paced world. So health is most precious asset anyone can possess. So do not let your busy routine and habit damage your condition and expose you to the risk of suffering chronic disease and non-curable disease. Next. Next slide, please. And also, too many people think they are fit but denying and dying due to cardiac arrest in the age group of 20, 25, 30, 40. Because you may be fit, you may look fit, you may be working out, but no one knows the amount of stress you are going through that causes inflammation, cardiac arrest, and diabetic mellitus. So that is why you need to do regular health checkup. And a common condition identified include high blood pressure through screening, high cholesterol, diabetes, thyroid disease, precancer conditions, early breast disease, health and lifestyle changes. WHO states that 80% of premature heart disease, stroke are preventable, and having a regular health screening can be part of prevention process. So one of the best or better options and most important benefit of getting tested on a regular basis is that you are able to keep a tab on your health. Your test result help you analyzing your current state and diagnosing your chances of suffering from a mild or chronic disease if necessary. So that is why better to do early detection because it's going to cure your upcoming diseases. Okay, next slide, please. And basically, your family history is very important also because some family history you can present with a cancer. So if you have a cancer in your family, then we will do the early detection. Next. What are the annual health checkup that we include in our health screening package? Family history, previous medical history, clinical history, what are the symptoms, your habits and addictions. Basically, it's your lifestyle. We also do physical examinations, heart and lung examination, general body examination, abdominal examination, and also physical sensory of the extremities. Next. So in addition to an overall physical examination, Bagan Specialist Health Screening package comprises of tests that help in the assessment of the functionality of your heart, lungs, digestive system, kidneys, liver, bone, immune system, and also imaging tests like chest X-ray, ultrasound. Depending on your medical history, optional screening are also available. They include cancer-specific tests such as cancer profile markers, as well as mammography gynecologic tests. Next. The annual health checkup usually include vision, hearing for senior citizens. We have also have a Dodge certified audiometry. You guys also can do your audiometry testing. Next. So what you guys need basically, so when your health showcase a positive result, you feel good and your confidence is boosted. You will continue to ensure that you carry on the activity that helps you maintain a healthy lifestyle in the long run. Furthermore, your positive attitude will keep you happy, which will indirectly keep your spirit up, both at work and at home. So you guys can go through our packages, standard and premium packages, depending on your age, gender, and also physical family history. We will give you the investigation according to your need. Next. So this is our Bagan Specialist health screening package that we have. We have health screening packages according to basic, vital, deluxe, and premium. Next. Okay, can move on to next one. Okay, basically before the health screening, the person has to be fasted from 10 p.m. onwards. After your blood specimens are taken, an ultrasound, MRI, CT, whatever procedures that we do, please proceed to collect a food voucher at the counter. All right. If you guys are wearing contact lenses, need to remove their contact lens to allow us to carry out the test. Next. Next slide, please. Before stress test, we usually do stress test as well. So usually for stress test, we encourage the patients to wear a proper attire, running, because basically they'll be running on a treadmill machines, wear exercise attire, it's preferable, and refrain from consuming a heavy meal before undergoing this test. So this slide, wellness or illness, we need to take accountability for our health. Okay, you decide which way you want to go. It is in your hand. Okay, I basically for illness, I for insulin, I for inflammation, and also ischemia or injury. So let's replace this I, which also signifies the ego and pride, with V, which also signifies humility and friendship. Okay, what you get is wellness. All right, so you need to stay well, stay healthy, and stay weak. How? By following these four paradigms: balanced nutrition, adequate exercise, good quality sleep, and emotional detoxification. Please don't overeat. Don't be too greedy. Take it easy. Chew your food. Eat slow. You need nutrition. Enjoy your food with good nutrition. Okay, as simple as that. Eat at right time and eat at right quantity. Do exercise and be active most of the time. Next slide. So I'm going to touch a bit on the inflammation, because most of our diseases, including young heart disease, young hypertension, all of the autoimmune problem are because of the inflammatory process. Okay. So what is inflammation? Inflammation meaning it is an immune system response to a perceived injury or infection. After an injury, it is good thing as it brings white cells and help it to repair and recovery. But when it occurs after exposure to toxin or chronic stress, like obesity and autoimmune disorder, then it can lead to problems like heart disease, arthritis, depressions, Alzheimer's, and even cancer. So most of the root cause of disease are inflammation. Where you can get this inflammation when you live a unhealthy lifestyle, you take a lot of processed food, a lot of sugar, this will lead to inflammation. Next slide. Next slide, please. So again, the inflammations means the cells are in distress. They release tiny cries for help in the form of inflammatory cytokines. So inflammatory cytokines are like interleukin 6 and TNF. All right. So while we don't have yet clinical studies cementing a causal relationship path leading from sugar to oxidation to inflammation, may help to connect the dots between modern diet and mental illness. And this statistic, okay, you can see type 2 diabetic mellitus is the most common form of diabetic mellitus. Accountability for 90% of all cases of adults. The onset of diabetic in Malaysia with a high and increasing global and local prevalence of type 2 diabetic represent a huge socioeconomic burden due to increased morbidity from accelerated vascular complication and premature death. Okay, type 2 diabetic mellitus is an important risk factor for cardiovascular disease, microvascular complications such as nephropathy, retinopathy, and neuropathy. So pre-diabetic, one step before diabetic. Most of the Malaysian nowadays, they are pre-diabetic. Okay, if you take randomly any of you, the HbA1c will be around 5.7 to 6.4. Okay, if the range is about 5.7 to 6.4, basically you are pre-diabetic. So either it's a path to diabetics or chronic or a chance to reverse your diabetes. So we got to make a decision in our mind, and awareness of this change is extremely very, very important. Next slide. Next slide, please. Okay, a little bit on liver and heart disease. So which one you guys think more important, liver or heart? Okay. What should your prevention plan for liver health consist of? If you ask me, liver is is equally important as heart. Okay. If your liver is stressed or not functioning well, think of fatty liver, which is now the leading cause of liver failure. many of us having liver failure. We do scan, the finding most of the time is fatty liver. Okay, this fatty liver, if you guys need to know, it's reversible. Okay, and for years and decades, it will be present with very vague symptoms in us, and it will be ignored before it actually hits heart. Right? Some of the vague complaints can be high cholesterol. Yes, you don't just think of the heart. Okay, high cholesterol can cause fatty liver, low libido or low bile. Diabetes can cause fatty liver as well, and fatigue. Most of the fatty liver patients, they'll be very fatigued and lethargic. Okay, what do you need to take? What precaution you need to take? Right, when it comes to heart disease. If it's genetic, what are your risk factors? If you have already developed a heart disease, how can you prevent it from getting? So that is why we always do the preventive health screening, so that we can explain to you guys and consult you guys on this. Next slide. Okay, this is the last slide exposed. So unfortunately, there is no shortcut or quick fix when it comes to health. Invest in immunity, which is the body's first and last line of defense. Okay, regardless of which religion you practice, how much money you earn, how beautiful you are, the size of your house and car, the strength or weakness of your body, the color of your passport skin, each one of us will one day end up like this. All right? Stay humble, don't walk with pride, eat when we are hungry, stop before we are full, exercise a little bit, smile more, stay off sugars to enjoy life. Quality of life is in your hand and is now. Okay, this is end of everything: your wealth, your health, your power, your beauty, your pride, your position, and your education, your everything. Okay, please take care of your health. Stay safe, everyone. Hopefully everyone is vaccinated, and I really pray that we can come out of this COVID pandemic as soon as possible. With that, I thank you, everyone.
Thank you very much, Doctor, for the info sharing session. So we'll be opening the floor to any questions from the audience. If you have any questions, you can direct it to the chat, or you can just straight on ask Doctor right now. So if anyone has a question.
Hi, doctor.
Hello, yes.
Hi.
Oh, you are. Hi. See you again.
Yeah. I would like to know how frequent should we do health checkup a year? Right. How frequent?
For a person more than 50 years old, I would recommend 6 months once, but with any medical problem. But those who are healthy, I would say maybe yearly once.
Yearly once. All right.
Yes.
So just now you are talking about liver. Is it? So for those, I mean, for those with gastrics, or GERD, they call it GERD, GERD.
Yes, reflux.
All right. Yeah, acid reflux. So what are the impact and what are the cause?
What are the impact and cost for the reflux, is it?
Yes,
Okay.
yeah.
A poor gut health. Basically, it's a poor gut health. Okay, poor gut health meaning more bad bacteria colonize in your gut, and more bad bacteria colonize in your gut. A lot of acidity productions, a lot of the enzyme is not functioning well. That's why you feel this gut problem. Apart from that, maybe other causes, maybe positive H. pylori, okay, or any hormonal disbalance. So that's why we need to do this screening. A lot of tests we will conduct based on the history. How's their eating pattern? How's their lifestyle? Do they like to take coffee and so on? So based on that, we will decide what are the causes of the GERD.
All right.
Hmm.
Okay. Can acid reflux lead to thyroid diseases?
Yes, of course, it's all interconnected. As I said, any hormonal imbalance can cause this GERD problem. GERD is just a symptom, it's not a disease. So it's caused by something. So it's related to something. So that's why we need to do further investigation.
All right. I see. All right. Okay.
Okay. Anything else?
Oh, doctor, I have another question. I have a friend that got positive COVID-19 lah. So
Okay.
okay, apparently he's already take his second dose. Okay, but unfortunately it's still not more than 14 days lah. Still just a few days, then he get the COVID-19. But right now, it's a very critical condition. So normally, what has been suggested to everyone that you need once you get the second dose, the immune system will only work after 14 days. Okay, within
Right.
the period you got affected COVID-19, is it going to work or that particular person need to go for another jab?
No.
No need.
Okay. Your friend, right? He already
Yeah.
take the second dose. After the second dose, he developed COVID-19, correct?
Yes.
Meaning he is boosted with the COVID-19 antibody as well. So after the second dose, of course, his antibody is not fully formed yet. But from the first dose itself, you already start producing few antibodies. Okay? Because of the infection itself, it's going to produce another antibodies like a booster dose. Of course, his condition is critical because of his premorbid. Maybe premorbidly he got diabetes, he's obese, his lifestyle and so on. That is why his condition is getting worse. But it's not because of the vaccine. He doesn't need to take the next dose of a vaccination in this 6 months period because he already got an adequate amount of antibody in the body.
All right, I see. Okay.
Mm.
All right.
Did I answer your questions? I don't know. I'm not
Yeah.
sure.
Yeah, he got also other issues with his health lah, like diabetics, and
So
also I mean high blood pressure, right? Uh, of course lah.
I hope
Okay.
that he don't succumb to more complication because he's already vaccinated. I pray for his speedy recovery soon.
Is it true, doctor, that I mean is I read this from the internet lah. They said that after your second dose, that is the lowest point of your immune system in your body. Is it true? After your
Because
second,
not only any COVID-19 vaccine, any vaccination, when you take the vaccine, right, automatically your body system is shut down because you are
hello, hello, doctor. Ali, can you?
Yeah, we're working with China. Something technical issue.
Sorry, I just tried to check with the Suguna with
Uh-huh.
again. Perhaps they have some line internet for the connection from Dr. Suguna's side.
there's a connection problem. We wait for a bit for doctor.
Actually, can I share for the some our health screen campaign during that waiting for the Dr. Suguna to get online back?
Yes, certainly, yes.
Uh,
We're waiting for doctor. She's currently joining in.
have you admitting him? Uh-huh.
Yeah, yeah. Yeah, everything okay, right?
Doctor, try to join the link again. Wait, Actually, I think the line still have a big problem from Dr. Suguna's side. We apologize from Dr. Suguna's side, but Inche Cairo Ikram, can you write down the question? I will pass over to Dr. Suguna, and she will reply to you, and I will pass over the questions and also the answer through Inche Ali. And others, I apologize again because we having some technical problem from Dr. Suguna's side. And by the way, for today, I would like to share that we're having some health screening campaigns from Bagan Specialist, which is for the Penang Port staff, because as I know that Penang Port have health screening benefit for all the staff. So here is some itinerary for our health screening package. So as you know that health screening package for Bagan have a 4 type of basic, vital, deluxe, and premium package. And as I know that some of Penang Port staff have a different type of their limitation for the medical benefit, and also some of the Penang Port also have limit ataupun have a certain package that they can entitle for the health screening with Bagan Specialist Center. So for now, for every patient who would like to take any kind of basic screening, vital, deluxe and premium package from Bagan Specialist, we would like to give a special corporate gift to the all Penang Port staff, which is if you entitle ada limit for the package screening, which is you punya entitle bawah 300, we can give and can entitle for the basic. Then here is the type of our package and also a corporate gift to the Penang Port staff. Kalau mana staff yang entitled for the vital and kita ada specific goodies corporate gift lah for the staff. And the big corporate gift yang kita boleh bagi kepada Penang Port is for the deluxe and premier, which is the premier deluxe and premier package. We have a special corporate gift which is the worst price harga untuk this goodies corporate gift is dalam RM150. And one more, we also give the special punya package which is sesiapa kepada Penang Port lah, especially pada Penang Port staff, which is kalau entitled deluxe and premier package, we akan bagi complimentary Georgetown Baby Hotel for the 1 night stay with the 2 packs free breakfast. And then for the premium package also, we also give the complimentary Bayview Beach Resort, which is kalau mana yang staff Penang Port yang mungkin dia ada limitation macam dalam 1,000 ke bawah, but dia nak dapatkan package premium at on 480, dan kita akan bagi this kind of complimentary goodies special corporate gift lah from our side, from Bagan Specialist to the Penang Port staff. Okay, mungkin after lepas dah dengar talk from Dr. Sugun side, can maybe staff Penang Port macam nak take this advantage ataupun peluang untuk dapatkan screening, can directly contact us. Actually boleh dapatkan contact number saya lah dari Encik Ali, which mana nak dapatkan appointment, so I can arrange the appointment to the all Penang Port staff. So here is yang untuk kita buat untuk Penang Port, dan kelebihan ini kita boleh kita open starting August sampai Disember 2021. First come first serve, dan kita akan fokus pada more kepada appointment basis lah. So any kind of package, let me know, dan I akan bantu all your staff from Penang Port untuk dapatkan slot bersama Dr. Suguna. And then dan juga dapat entitle lah for all package yang kita ada, semua akan entitle for the corporate gift for Penang Port staff. Okay, itu saja daripada saya from ini, from marketing department. So anything, kalau ada apa-apa pertanyaan directly, kalau nak tanya apa soalan kepada Dr. Suguna, can leave your question with Encik Ali, and Encik Ali can pass over to me, and I will pass to Dr. Suguna to answer your questions. And also in regarding this kind of package, yang mana nak dapatkan this kind of health screening package, also can get my contact number from Encik Ali also, and I will assist you, and then I will give a set appointment to you, and then that's it from me, and then thank you.
Right, thank you very much, Aini. I'm guessing that doctor is still having trouble with the connection, right?
Yes, she still cannot sign in the meeting because of the internet problem.
I think in terms of that, I think it's already 11 and it's already 12. I think we can wrap up the webinar session for today. So basically, could we have on behalf of Bagan, we have a screenshot of everyone. So everyone, let's open up the your camera screen. We're going to take a screenshot. And for doctor's part, Cik Aini, can you be the representative? Okay. So everyone, yeah, kindly open your video in your screen so we can take a screenshot and wrap up the webinar session for today. All right. Okay. Okay. On the count of three. One, two, three. More. Right. Okay. Right. Okay. One, two, three. All right. Okay. Thank you very much.
Right.
Right.
Thank
So
you,
that
Encik
was all for
Ali.
today. Thank you very much for joining the session today. Apologies. We apologize if there's any inconvenience on both our part. Thank you very much for your time. And from us, hope you have a nice day. Assalamualaikum and a very good day.
Waalaikumsalam. Terima kasih. Thank you.
Thank you.